Pregnancy is often described as a journey of hope, joy, and expectation, but sometimes danger grows quietly, without pain or warning. Today, we're talking about placenta previa, a condition that can turn a normal pregnancy into a medical emergency within minutes. Hello, everyone, and welcome to the HealthWise show. My name is Uche Namadi, and as usual, I am not doing this alone. With me in the studio are my trusted co-hosts, Dr. Lani Yoweye, to help us understand the medical facts behind pregnancy complications, and Ms. Patsy Mokunga, the lawyer and the voice of everyday Nigerian, asking the questions families wish they had asked earlier. In a moment, we'll hear a true story, one that reminds us why antenatal care and emergency preparedness are not optional. Before we continue, do not forget to like, subscribe, share, and follow SynLab Nigeria on YouTube and on Spotify. Now, let's hear a story from Patsy.
Okay, so this story goes as thus. It says how placenta previa changed the course of my normal pregnancy. In 1992, during my last pregnancy, everything appeared to be going smoothly. There were no warning signs. My due date was still weeks away, and I had every reason to believe the pregnancy would progress normally. Then, without warning, I began to bleed heavily. I was rushed to the hospital where the doctors diagnosed placenta previa. The placenta had separated while my baby was still inside me, putting both our lives in immediate danger. There was no time to observe or wait. I was taken straight to the operating theater for emergency surgery. My baby was delivered too early and had to be placed in an incubator for about a week. After the operation, I was told I had lost a significant amount of blood and required 2 pints of blood to survive. What stays with me, even years later, is how quickly everything changed. One moment, I was carrying what I thought was a normal pregnancy. Next, I was fighting for my life and my babies without ever knowing the danger had been quietly growing inside me.
Wow.
Mm.
Wow. Did you say babies?
Well, here it's, yeah, no, like babies, like her baby. She's fighting for her life, and that
Okay,
also
and
Of
means
our
her
okay, I thought
baby's
you
babies.
meant
life.
like two
Oh,
babies.
No,
oh.
The story is frightening,
fine, yes.
Mm.
not because it's just dramatic or something, because it's actually real. Somebody actually told this story. But before I ask for Dr. Ware's input, can you explain placenta previa?
Mm.
Let's even understand what it is and how it comes about.
Okay. Placenta previa is just basically low-lying placenta. Yeah, when the placenta is low-lying, and I will explain what that is. Normally, placenta should be located at the top of the womb,
Mm-hmm.
or somewhere in front, or somewhere behind. But usually, you would see it at the top. So, but then in placenta previa, the placenta is located very close to the neck of the womb. That's the cervix.
Okay.
So it can partially cover the cervical opening or totally cover it. You understand? So basically, placenta previa just means low-lying placenta, and obviously that has its effects. You understand? Especially usually you don't get to really notice until about the third trimester, because in first trimester the uterus is still growing. You understand? So, but usually the third trimester, the placenta becomes, is low lying. Then usually you're going to have some complications, like what you notice there, bleeding, could happen. And then of course when there is bleeding, the mother's life and the baby's life could be compromised, because
Wow.
the bleeding can be potentially life threatening. You understand? And from the story that was read, to me, it seemed as if, because she said the placenta removed
It's
something,
separated. I was going
separated.
to ask about that.
So that's one of the complications that you could get rather from placenta previa. That more or less sounds like placenta abruption.
Okay.
Yes, like the placenta, just because
So
in
it
placenta
can
previa,
progress.
like in placenta previa, you have a low-lying placenta that either partially covers the cervix or totally covers, and the baby passes through that opening. So, and then there's a whole lot of, especially in third trimester, could have a lot of, contractions there. So you have, bleeding could actually occur as a result. So basically, that's what just placenta previa, is all about. And one of the things that you see commonly as a result of placenta previa is the bleeding, because that's what you would see. Usually, the pregnant woman will present with bright red, bleeding. The bleeding is, and it's painless. It's
Oh,
usually
really?
painless. Yes.
But it's heavy.
Yeah, it could be potentially life-threatening.
No,
It could
but
be.
like I'm saying, like
It may not be
amount.
heavy ab initio, it depends.
Okay.
You understand? But then you see bright red vaginal bleeding, and of course, it's painless. Occasionally, you have some cramps, alongside with it. So, any woman who presents in third trimester with bright red, painless bleeding, you should rule out placenta previa, because you could have a potentially life-threatening situation, like you saw in the story that you read.
Okay, so like if there's bleeding and there's placenta previa, right? What then? Like, does the baby always have to come out immediately?
The baby might have to come out immediately, depending on the extent of the bleeding. I mean, the gynecologist will assess the situation. So there are certain indications, that you would see that will make you decide to bring out the mother, and the baby. But obviously, what you should always watch out for, or what gynecologists always watch out for all the time when you have placenta previa, is that potentially life-threatening bleeding situation. Because usually, when you have placenta previa and then you have a significant amount of blood loss, then the baby must come out, because placenta previa is one of the common causes of preterm delivery, because the baby must come out, especially once the bleeding is significant. But if the bleeding is not significant, of course, the gynecologist will monitor, the woman and the baby. And of course, we'll look out for certain, things that would make him or her decide, whether to bring out the baby. But of course, when the bleeding becomes worse, then the baby has to come out.
It's quite scary because for me, the fact that it doesn't give a warning is a problem. And then when the bleeding starts, time is not on the side of the patient or the baby. So now my question is, can a pregnancy truly be low risk? Then pregnant women, are they adequately sensitized, maybe during antenatal visits, that placenta previa is a thing? Oh, you should watch out for it though. And how prepared are our hospitals for emergencies like this?
Oh, okay. I think I understand what you meant by can pregnancy be low risk. Yeah, there are some risk factors that, make, if you identify those risk factors in a pregnant woman, you're more likely going to see cases of placenta previa in those category of women. For example, women who have had multiple pregnancies, they have a higher risk of actually having placenta previa. Women who are advanced in age, 35 years and above, more likely to have. Then someone who has had a cesarean section before, or a surgical procedure on the uterus, you understand, is more likely to have, placenta previa also. Then, of course, someone who has a multiple pregnancy, twin gestation, triplet gestation, multiple pregnancies, you can actually see them also. And then, of course, women who smoke and drink, I mean, they could also have.
Do they still exist in this age? Why are you causing problem for yourself?
So yeah, they exist.
Oh my God.
So it's a lifestyle, it's a habit.
Wow.
So people will do that.
So
for me, I think it's just, identifying, knowing those risks, and then identifying them, in women, they are more likely to have placenta previa. Of course, one of the ways to actually, I mean, it's not like that this is going to happen, but those kind of category of women, they are high risk pregnancies. And of course, when a gynecologist or an obstetrician rather identifies a high risk pregnancy, of course, the schedule for antenatal visits and the frequency of certain tests, the certain tests will be ordered that are actually specific for that situation. And the frequency of antenatal visits is usually going to be more than, of course, when you have a pregnancy that has been adjudged to be low risk. In the real sense of it, pregnancy itself is a risk. You understand? So, but then when you identify all these risk factors, generally, so of course, the obstetrician knows what to do. And one of the easiest things to do. Don't let me use the word. I'm looking for the right word to use. Now, one of the things to do to actually preempt preeclampsia is to do ultrasound scan. You understand? So that means that's the only way
So
you
in an
can know, because
ultrasound, you would see
it will show whether the placenta is low lying or whether the placenta is placed,
Okay, I have a question.
at the proper place.
Okay.
So, like, if you said placenta previa is just the low-lying placenta.
Exactly.
So, without bleeding or anything, on a normal, if it's just that the placenta is low-lying, there's no issue.
There could be an issue.
Which
It's
is?
a potential issue.
Okay.
Yeah. So if you have a low-lying placenta, I'm not sure any obstetrician would just leave it at that. You are going to be monitored, and then, of course, you are going to be counseled properly on what to expect. And of course, especially because it's usually going to happen, most likely happens in the third trimester. Do you understand? So a low-lying placenta is not normal.
Okay.
You understand? It's not normal. So then it's left for the obstetrician to actually risk stratify you. You understand? To determine how
risky.
close it is to the cervical
Cervix.
opening. Is it close? Is it 1 centimeter close, 2 centimeter close? Is it covering it totally? Things like that. But then the obstetrician will do that. But then once the obstetrician knows that you have a low-lying placenta at third trimester, then of course he or she would pay close attention to that particular pregnant woman.
Okay, follow-up question. If it's fully covering the cervical opening, right, does that mean that even without any bleeding, you absolutely have to have like a cesarean section because the baby can't pass?
A lot of the times that happens. You have to do a cesarean section.
Sorry, let me draw us back to the question I asked, because I am of the opinion. Well, firstly, kudos to those government hospitals where matrons gather the pregnant women, they sing praise and worship, they give them lectures. Yes, I've been opportune to sit in
You've
one.
done
Yes, yeah. So
dancing sessions.
yes. So should they be told about this possibility during antenatal classes?
If yes, case by case basis?
How? No, because some people do the general one. Yeah, so like they tell you for this hospital antenatal days.
No, I get what you're saying, but like what we're looking at in my head is an abnormal case. Do you get? So why are you?
There is no warning. You're not getting it.
No.
The doctor can pick it up
does.
now.
Let me paint this scenario. You have scheduled visits for antenatal, scheduled antenatal visits in pregnancy, and then you have periods where you have to do scans.
Yeah,
and then you come in to do scans.
So when reviewing your scans,
then you see that, and then so it's your obstetrician. So it's not as if you gather people and then
okay. So I see your point now. But another thing I would like to ask is in Nigeria today, or in our healthcare system, are we truly equipped to handle such emergencies, or are there still places where it could be negligent?
Well, the teaching hospitals, the general hospitals, are adequately equipped. I believe any hospital where you actually have an obstetrician and a gynecologist, a well-trained one, is equipped to actually handle placenta.
I have a question about this being equipped because in this one, the baby had to be born prematurely and had to be put in an incubator.
Oh, that's what you mean.
So where are they? Because I'm very aware.
Yeah.
That I know cases where the baby was born and there was no incubator.
There was no incubator.
A lot of hospitals still do not have incubators or have enough incubators.
And let me guess, the baby didn't survive.
Many times now.
I think
I've had a situation I was very aware of where it was twins. Both babies died because they were born in one hospital.
And they had to
needed to be
hospital.
Put in an incubator. The way they even shipped them, the mother that had just given birth plus the two babies were just put inside taxi. Not ambulance or anything.
No.
And they were running across town to another hospital before they got there. The babies
I quite agree with what you're saying. But then my own is, of course, there are so many hospitals, and most people would actually, a lot of people would have their babies in, traditional birth attendant homes. Some will have in primary health centers. These places are actually not equipped. But then the teaching hospitals, that was why I was very specific. The teaching hospitals, the general hospitals, they're having, obstetricians and gynecologists. Definitely they would have pediatricians, and then most of them are equipped to handle this. But of course, we know that most of our pregnant women, usually quite a number of them, don't let me use the word most, they visit the primary health centers. It's okay because more often than not, most people will know how many people are actually, having placenta previous. You understand? So a whole lot of times people would go to traditional bathing homes, faith homes, and things like that. But then the danger. So the thing there is just that we are now let me say, underlining the danger in these things. You understand? Because if you're attending such places, you will not even be picked from because most likely you're not going to even be seen by an obstetrician.
Yeah.
You won't even see an
Either would you do
obstetrician
scans.
through. Even if you do the scan, maybe you're going to one faith home, the midwife will just look at it. She probably doesn't even know anything is low line. And even if the radiologist writes this is low line placenta, she probably doesn't know the implication.
But
and
wait,
then
let me ask
coming
about
and stuff.
because from my knowledge, right? And I'm not a health person, but a midwife ought to be adequately trained, or is a midwife just trained to birth the child? Isn't she trained in all incidentary knowledge to childbirth?
Then you should be very specific about midwives. There are registered midwives that
And
actually go
auxiliary
to
nurses turned midwives.
and they are traditional birth attendants. We all call them midwives. Of course, they are registered. And a registered midwife, of course, will be trained at least to support those things. But then, how many of them do you actually have within the community? You have a lot of faith homes and traditional birth attendant homes.
I've never even heard of a faith
home.
Oh,
yes.
Today.
Churches do have faith homes.
Okay.
Wow.
Yes. And then, of course, you also have people who are even working in primary health centers who are not even registered midwives.
Yeah,
they're just nurses. Yeah, you understand.
But in
for
Nigeria,
me, I feel
isn't nursing and midwifery isn't the training merged?
Well, I know that there are RNs, there are RMs. That I know. I'm not a nurse, but I know that
so registered nurses and registered
midwives. Registered midwives. I know they have.
But
so there are some people
some
people are
I've
RNs.
seen it before, nursing and midwifery. So sorry, I'm not saying this I'm not saying this I know it. I'm asking because somewhere in my head I think I've seen it before, and in my mind I was like, oh, so in Nigeria I remember having that thought nursing and midwifery are kind of merged together.
I know they run different. So there are people who, of course, you have a bit of both, know. But then I know there are people who are registered midwives who still do the 3 years in the nursing school, and then I know people who are also registered nurses. They, of course, they rotate through the postings, but then there are people who have registered midwives, and of course there are people who have BSc nursing too. But then I'm not a nurse, but it's part of their training. I know, but the truth is, you get to a whole lot of centers, in Nigeria where you don't even have any qualified person. The only qualification is this person has been taking delivery since the Lord Jesus Christ. And so it is assumed that this person has a lot of experience. And that person may not even have the requisite, knowledge to handle some of these cases.
Can we circle back a bit? Because, you talked about the woman and her babies being shipped via a taxi. No, she was when she was citing an example. So that was when I asked the question if the healthcare system is equipped to take care of this. So we've talked about the baby part, the incubator and the rest. How about the mother? Because she said she was to take 2 pints of blood. Do we have systems, that are readily available and accessible? Because I hear things like you have to buy blood, you have to buy blood,
or you are running around looking for who donates blood.
Yes, and for rare blood types too. These are the issues. That's why I said, are we equipped for this? Are we even ready for placenta previa? If anybody is going to give birth in a particular hospital, is that hospital ready for emergencies like this? Because again, the woman said she and her baby, they are fighting for their lives like this. And this as far back as 1992. I don't know what's going on now in 2020.
Well, I want to believe me. I'm not. Again, I want to believe that improvements have been made, but also, as much as improvements have been made, we find a lot of things that were problems 20 years ago,
and there are still
30 years ago
now.
In Nigeria. There are still problems now.
Okay.
Right?
Now, to answer that, of course, I'm a hematologist. Blood is still scarce. And of course, we still have a high number of women dying from obstetric blood loss. It contributes significantly to maternal mortality in
High
Nigeria.
number.
Yes, it contributes significantly to maternal mortality in
I
Nigeria
have
up
question
till
in my
now.
head.
So again, the normal issues of getting blood, getting prepared, our preparedness, and that still underlines the fact that the most practicable way to go about this is pregnant women should register
Early.
should register early and should register at least try as much as possible
Not
to register in
even
the general hospitals.
get them to
the
even
teaching
register.
hospitals.
Some mothers,
Yes.
some mothers, all this I have born before. I know how it goes. The second time, they will now say they're not registering.
Yes, they
We
do
have
that.
stubborn mothers like that.
I've heard of that. And because also
And of course,
there's
there are some
mindset
private
that-
hospitals also that are also equipped, to handle
Yes,
such
sir.
emergencies.
But
But
they would
then
be
we still have challenges in this area, because it is a hydra-headed problem. Some people it starts
many
from
things just
it starts
coming up.
it starts from someone not recognizing that this is a potential issue. Then another thing is we are not even ready to actually handle the challenges. And of course, blood in Nigeria has remained perennially scarce.
Okay,
You
can
understand?
I ask why? Because
so-
that is
Yeah.
do you I'm trying to I know that I used to know this, but I'm trying to pull the knowledge in my head and it's eluding me. Does every blood donation in Nigeria have to be voluntary?
Okay. Yes.
I remember studying
Yes,
this at some
exactly.
point.
Well, we
Because
still have some
that
commercial
is what
donors.
the WHO. That is
Commercial donors.
Yes.
We're trying to stop that.
we're talking
The
about
world.
it. We were
I
talking
was
about-
here thinking.
No.
Who is this?
That is what the World Health Organization says.
that it should be.
Yes, it should all be
I
voluntary.
was thinking
And
I knew
it says
somewhere.
that the blood requirement of a particular population is 1% of the population. For example, in Nigeria, if we're 200 million, so our annual blood requirement is 1% of that. And
we don't still
all of that should come from voluntary blood donors. Now, you see why blood is scarce in Nigeria. And currently in Nigeria, about 90 to 95% of the blood we are having, they are coming from paid donors and family replacement donors. But we all know that most of them are actually
I
paid
don't
donors.
think that there's
So-
enough education about blood donation generally in Nigeria. Do you
I quite
understand?
agree.
I don't think so. I don't think people know that they can donate blood because I feel like Nigerians they're kind-hearted enough, right? I do think so. That
Kind-hearted.
to do this voluntarily. You
It's blood
people
we're
are
talking
looking at me
about.
like, but I feel
We're
no,
waiting
yeah,
for it
it's
to land,
blood,
though.
right?
Mhm.
But I feel like if there was enough awareness, people would do it more.
I think
because up until I was like in university was the first time I ever like seriously saw opportunities to voluntarily donate.
But there are blood drives. I'm telling you.
None of them
Yeah.
ever reached me in my entire whole life.
Maybe you were not positioned
No.
to be reached, but there
Yeah.
are blood drives.
I think
no.
I was
Wait,
positioned well
no,
enough.
there are blood drives, but we're trying to stop commercial donors. Do you know
Yeah.
why?
Yeah.
The greed
Oh
behind
no,
it.
you don't
So
have to tell
people
me
lie.
about commercial.
And so
Anything
you
that
know
joins-
how
no,
it
but
goes.
anything
No,
about that
wait.
joins you selling anything human body for money, people will abuse it.
No, it's not. It's not. It's
People
not
will
even. It's
abuse
even. It's not. It's even deeper than the greed. It's not even safe.
If
I'm-
you,
I'm-
you,
Causing harm to them.
you
Yeah.
attach
It's not
money
even
to
safe
it, people
to the-
will remove the last
It's-
drop of blood in their
It's
body.
not even.
They
See,
will. Sure, they can blend
it's
ugu
see,
leaf
It's not
and
even.
drink
See,
outside
wait.
the hospital.
It's not even safe for the recipient. Now I will explain this. Now, a commercial blood donor is only concerned about the money he or she wants to make from it. Now, mark my words, she. Because a woman can donate blood.
Yeah.
I mean, that's another
I've donated
thing that we
before.
need to, because a lot of people think women are not supposed to,
No,
to donate.
we
So
can.
now, for voluntary donors, you know you're a voluntary blood donor. Then there are certain lifestyle
That
that you
you
will
should
stay
not
away
have.
from because you know you donate blood voluntarily. There's this popular footballer, Ronaldo, who doesn't have tattoos on his body because he's a blood donor. Yeah. So there are certain things. Yeah. So there are certain things you will not actually do. Because you're a voluntary blood donor. Because first thing is the blood must be safe. Blood from commercial blood donors is not safe. So
But
that is
even if you're
and
a
that is
commercial
why
blood
the
donor,
world
shouldn't they like do all the checks necessary?
yeah, we'll do
before
the
they collect it?
checks. Yeah, it's from the checks that you know, and that's why I kept saying the blood is scarce. Now, of course, you do the checks. So in centers where they at least to a very large extent they can actually screen very well. You find out that you're having a lot of donors coming, and quite a significant number of them are not fit to donate.
And as they're
You
coming, they're
understand?
going.
And then you still
What
have
can make you
centers. Wait,
unfit to
you
donate
still
blood?
you still have some centers where they don't even have adequate screening. That's what I was coming to. You still have some centers that don't even have adequate screening facilities where such kind of donors will pass
The
through without it
problems
being
are
detected.
many.
So there are a lot of challenges here. So it is not just all about there's a placenta previa. Just as she said, even in the teaching hospitals, the general hospitals, you are screening, you are equipped to even screen, or you have a private hospital where you have the right equipment, and then you are getting like 20 donors, and 10 out of the 20, they are not fit to donate. Of course, that has reduced the number. And then you have maybe like 5 women that need blood now. And each of them will need at least 3 units. And then you got 20 donors for them. And then you screen, half of them are not fit. So at the end of the
From
day,
that half, how many units are you
you understand.
Yeah.
So I'm just trying
It's
to
one unit per
I'm just trying to
person,
break it down. That was why I
Not
said
even 2.
yeah. So
One.
these are the issues. So I quite agree with you on the advocacy part.
I think
When
there
it comes to
needs
blood,
to be
we
a lot
need to
more
actually continue to talk to
I think
people.
we need to get into
and
people's
encourage
faces
them
and
and let people
encourage
understand that you can donate blood. It is okay to donate blood.
And you might be like, it has to be incentivized, but like just the knowledge of like, I helped somebody, I donated blood, might be enough to convince.
And let me say this: 1 unit of blood donated.
People like to be heroes.
Saves
In a
3
way,
lives.
What saves 3 lives?
People like to
Exactly.
be heroes.
And then again, it's also very, very important too, because if you're coming to donate blood, you also be tested for hepatitis B, hepatitis
Free
C.
test.
Because honestly,
HIV,
as he
free
was
testing,
talking,
and all
I'm
that.
thinking to myself, like, do I qualify to be a blood?
Fancy be coming down.
No.
Let's come back to
Can't you see
placenta
that?
previa.
We are digressing.
I want to ask again. So, are there signs apart from the scan that the pregnant woman would go for, and then the OBGYN will review? Are there signs that could suggest like spotting, during pregnancy?
Spotting tends to occur in the first trimester. Placenta previa doesn't occur there.
Okay.
So it's bright red vaginal bleeding.
Active bleeding, not even spotting.
Yeah, not spotting.
Painless.
And it's painless. So bright
I'm
red
such a good
vaginal bleeding. So you see bright red vaginal bleeding.
So once you see it, you run.
Yes, especially when you're in the third trimester.
Okay,
No wonder they used to tell
I had a
us,
question
pack
about
your
this.
bag ahead of time.
Okay, I had a question about this. Like,
Yeah.
from when a woman sees that bleeding, that bright red bleeding, how much time do you think
Immediately. I
So
would say immediately, as soon as possible. Just get to the hospital. As soon as possible, because it could be very dramatic. So you can imagine,
It
because
can
it's
go from 1 to
potentially,
100
it's
very
potentially
fast.
life-threatening. You can just imagine it starts as small bleeding, and then you're watching it, and suddenly in an instant, it just goes from 0 to 100.
Because I had
or
that
something
feeling
like
that, it might be something whereby a woman, could be women who would see maybe small blood and just be like, let me watch it, let's see if it will.
I would rather you go to the hospital.
You'd rather you go to the hospital.
That's why
Especially
I was
all
saying
those
earlier.
second, third time moms
Thank
who
you.
feel like
That's why the
we've been
matrons will
here
tell you,
before.
pack your bag. You see it in the market, you start running to the
Yes.
hospital. They should be
You're-
bringing
you're
your
in
bag
your
later.
third trimester, and then you're bleeding. You're seeing, blood. You should, and you've calculated in your head.
Yeah.
You are not term.
Yeah.
Then you should not just wait. You should go straight to the hospital,
Wow.
because it won't happen at term. So it's not sure you are seeing. It's not going to happen at 37 weeks
It's
or
not
38
sure.
weeks. It's not sure you are seeing.
It's
It's
just
going to
a
be
bit
so
scary,
very-
honestly.
Yeah.
I'm not going to lie, because it's pregnancy, and you on one end, it's like pregnancy is this normal thing that a woman's body should be equipped to do, right? And on the other end, it's like there's all these
50-50,
things that
man.
could.
Yeah, what could happen?
So most
happen.
times when you go in and come out, it's a miracle.
It's a miracle.
It is a miracle.
It's a
That's why
miracle.
we say in Yoruba, "Ekwe womo." I know you guys don't understand that.
Translate it.
You're just coming back from a
It's
very
the greeting
difficult,
for the journey.
difficult journey,
Oh, wow.
a treacherous, journey.
This has been an exciting topic to discuss, and we hope you've learned a lot. So before we say goodbye, Patsy, what is your advice to pregnant women out there?
I think pregnant women are already sensitive enough, but like, I think from what you said, right?
And already sensitive.
No, they are now,
Good.
and they take it seriously.
Okay.
Women don't play with their children.
Mm-hmm.
But from
Yeah.
what she said, that tendency of if you're a second, third, fourth, fifth, sixth time mom,
Multiple. Yeah.
Mm.
and you're feeling like I have this down to a science, don't
Mm.
feel like that, and run to the hospital. He has explained here the signs that you should look out for. If you see that bleeding in your third trimester, don't take anything for a joke, right?
Mm. Yeah.
Yeah, and I think that's it. And this thing about registering for antenatal, doing it early, doing it at a reputable hospital, maybe a
Mm-hmm.
general hospital or a
Mm-hmm.
government hospital. From when I was a child, I remember my mom telling me that, like, for each of her pregnancies, she registered in two hospitals, like a private hospital, and she still did general hospital. And she would
Yeah.
always say, even then, she always used to say, you must register in she would always tell people that they should go to the general hospital, even if you've done in private hospital. Now you are explaining this, and I'm kind of seeing the reasoning behind it while she would say something like that. So register. Because I know women who delay antenatal, who don't do, or who might even skip it altogether,
Yeah.
because they just don't feel like it's that necessary. They already know what it is after all. They'll rather pocket the money. So I think from everything we're saying here, it's like, don't do that. Go to the hospital.
Don't just.
Don't just do
Don't
that.
do that.
Yeah.
Just go to the hospital. Go
Yeah.
go to the hospital. Go to a good hospital, and maybe even ask questions when you go to a hospital. Maybe ask, do you have this? Do people have
A blood
incubator?
bank,
People have
incubator.
blood.
Mm.
These
Yeah,
are
things
questions
like
Have
you
your
should
own
that.
mini
ask.
checklist.
Yes,
Yeah,
kind of like
exactly.
ask them, do you have this? So that you know that the hospital is not on the day it is happening. You're now realizing where I registered, though. They don't have.
That would be very bad.
Exactly.
Dr. Way.
I was actually going to say something about that. But well,
Yeah.
for me, it's from the area of the challenges. Yeah, you may actually register in a hospital that you think is very good, but then they may actually not have access to blood readily. And as you said, they may not have incubators, and all that. So that's why it's very, very important for you to register for your antenatal in a hospital where at least you're sure that their emergency responses, are going to be, because anything can actually happen. So the take-home point is there is no risk pregnancy. There is no risk pregnancy. So there are risks all along the way. So, and then you should be equipped to know about all these things, and then put all these things at the back of your mind, and try as much as possible to seek, seek consult with a obstetrician if you're actually noticing any of these, signs, and then if you have any of these symptoms, especially if you're pregnant in your third trimester, you're bleeding, fried blood, and then you notice that, the frequency at which your baby kicks is
Yeah.
reducing, because that would also show. So these are some of the things that, and as a pregnant mother, or you should be aware, and then you should know.
Wow, thank you very much. So there you have it. Placenta previa can occur without pain, bleeding in pregnancy during the third trimester.
Yeah.
It's never normal. Run to the hospital. Emergency delivery is often the only life-saving option at that
Yes,
point.
that's the only
And for
solution.
the blood donors, a pint of blood can save 3 lives.
Mhm.
You are helping a generation if you don't know. Yes, that's what I think. Yes. And then regular antenatal care. Please don't be like Mama Nkichi that would say, oh, I have given birth to 3 before now and I did it without no 2 pregnancies are the same.
Exactly.
Yeah, so you never, it's not so, you don't plan for placenta previa, but you prepare for the worst.
Yes.
So like she said, have a checklist, ask questions. It will really go a long way. So my sincere thanks to our co-hosts for their insights, that's Dr. Olani Yowe and Ms. Pasi Mukunga, and for sharing their insights and contributions, and our anonymous guests too. Thank you for sharing your experience with us to help other women out there. Do not forget to like, subscribe, share, and follow SynLab Nigeria on YouTube and on Spotify. You can also follow SynLab Nigeria across all social media platforms. This is the HealthWise Show. My name is Uchenna Namadi, and I'm signing off.